every other Friday, we like to visit with our doctors from Rothman Orthopaedics. Dr. Vaccaro, how are you? Good morning.
I'm doing great. How are you guys doing today?
Good.
Great to listen to you.
Well, I got to tell you, you have an interesting relationship that you don't know. One of your former patients is right here. And one of the reasons why he is with us in this capacity is because of you.
Yeah, Doc, I've never met you. I owe you a huge debt of gratitude. I only know your name because of my medical records. But I came to you and no, because you were the attending physician in the trauma unit when I came in from a car wreck with a C2 hangman's fracture. And you got me right. I remember in a daze, you told me I could either get the halo or a hard cervical collar, but I could never take it off. And I listened to you so much that I showered with it on for like the first 2 weeks until I saw like Dr. Albert was actually my physician after when I did follow-ups.
Well, you made the right choice not getting a halo.
Yeah, so, I mean, you stabilized me. I was in bad shape. My lungs were collapsed. I was not in a great space, and you hooked me up that night. I just remember your voice, and I saw your name in the medical records later, and so I owe you a huge debt of gratitude, and thank you very much.
Well, I'm glad you're doing well. And by the way, you look 10 years younger when I first met you.
Doc, is that the greatest reward for you? Like when you hear a story like that, I'm sure you get it all the time. I mean, is what warms your heart and is the engine to keep you going?
Right. That's exactly it. So in our profession, we take care of people who are injured all the time. And when one person says that you've made their quality of life better, it makes you feel good. Because as you can imagine, in any profession, it's a lot of frustration with insurance companies, with this or that. Just hearing someone say thank you is the juice we need to keep going. So we love it.
That's beautiful. I mean, you guys do God's work. You really do. I think about it, and we take it for granted about the art of movement, right? We talk about movement. We're sports guys. You know, we're playing it, trying to stay as active as possible. And, you know, you guys at Rothman, the great doctors at Rothman, keep us in motion. And I think that's the greatest gift.
Thanks, Anthony. We appreciate it. We appreciate your support.
Andrew, you want to ask Doc? Because I know we're going to talk about, this is interesting, Doc. I know we were going to talk about the neck and We
can talk about anything you want to talk about.
Thank you. But tell them your story.
Yeah, hi, Doc.
This is our producer, Andrew.
About a month ago.
Put yourself up there so he can see you.
Here, let me pull that up. But about a month ago, I herniated my C6 and my C7 in my neck. Just recently went and had an MRI done, and they said that the disc in my C6 is completely gone, and that my C7 is partially gone. So do you have any recommendations or anything that I should do?
Yeah, so I'll tell you what I look at it. So when I see that, I look at the plain x-rays to see your alignment. Do you have a deformity? I see the quality of your bone. Then I look at the MRI scan to see, is it the nerve being compressed or the spinal cord? And then I correlate that with your symptoms. So you have arm pain now.
Yes, a lot of arm pain.
Okay, so you will get better, by the way, because you'll get better either with a non-operative treatment, which is rest, anti-inflammatories, with or without injection. You'll get better. You have a 70% chance of getting better that way. And if you don't get better, the surgeon will now look at you, and that we love it when people have primarily arm pain or a neurologic deficit, because once we remove that disc off the nerve, you're going to feel great. Okay. So you're a candidate. So what I want you to do is I want you to ask Anthony for my phone number, and I'll take care of you.
Okay.
And then go.
Perfect.
Thanks, Doc.
I appreciate that. Thank
coming
you.
to the rescue again, Doc. We really appreciate it. And one of the things about the neck that's so delicate, and Lonnie Walker has it, and obviously when we talk about sports injuries, you're not the treating physician, but we talk about them. It's great for our audience to understand about that. So if they have a neck strain, like in the case of Lonnie Walker, what are some of the causes and what's the treatments for something like that from a neck pain? So, you know, people wake up after a bad night's sleep and the next thing you know, you're miserable because you have neck issues.
Well, the nice thing is a strain is usually a self-limiting process. So usually people are better between 7 days and I say 3 weeks, it could be 6 weeks. with Lonnie, I Googled the mechanism. I saw it when he fell. I think it was March 14th.
Yeah.
He fell and hit his. So that concussion can give you a lot of symptoms of a neck strain too. He hits his head. He's got headaches. He's got concussion. That's more worrisome than a neck strain because a neck strain and it comes in three different variants: type 1, type 2, type 3. Type 1 is a stretch. Type 2 is a partial rupture of the ligaments, and type 3 is a complete rupture with or without instability. So depending on what his plain x-rays showed, and then in a professional athlete, I always get an MRI scan. I always get one. I want to know, and he most likely had a CAT scan. So the CAT scan will tell me, did he break something? Okay, he didn't break something. MRI scan will show me if there's soft tissue disruption. If there's not, then he's going to get better 3 to 6 weeks with non-operative treatment. He should get better. If he doesn't get better, then something else is going on. And you and I know whiplash can have long-lasting effects. So if you look at his mechanism, that's a classic mechanism. Boom, he hits his head. I mean, that was a violent hit.
Yes.
I mean, now, when I saw it, I was like, oh, God, that was a violent hit. So that man should be uncomfortable. But it was interesting. I read all the press releases. They were going to try to get him back pretty quick. And I was like, God bless him that he felt better that quickly. But it can have, like, people get whiplashes from a hyperextension injury. That can last months and months.
Yeah.
Professionally, as long as there's no instability and there's no fracture, you try to get him back to play as soon as you can. That's what we do when we take care of the.
That's anything with the neck, man. That pain is just nasty. It just is. Can it worsen? Can you?
It can worsen. Say if you have a disruption of the ligamentous complex, and you go back too quickly without resting it, you can get worse.
Yeah.
Say if you have instability that you don't pick up, and you go back to place, you can get worse. So as long as there's no instability and the MRI doesn't show anything alarming, then you go rest, anti-inflammatories, stretching, range of motion, and then you work on getting the muscle, the paraspinal muscle, strong enough so you can go back to compete.
There you go.
Mm-hmm.
He is amazing, Dr. Vaccaro.
Yeah, he's always in my world a huge debt of gratitude, Doc.
What's your sport, Doc? What's your favorite sport?
Okay, so I love football. So I was a team doctor of a spine surgeon for 20 years. We just stopped this year, but so I love football. I stood on the sidelines for all those games.
I met
love
you
it.
on the
And by the way,
sidelines.
and by the way, it's amazing those large people, how strong they are and how they hit each other. Like, I played football in high school, and I'm like, I thank God I don't play football now. When I left high school, I wanted to play college football, and then I look at what they go through, and I go, thank God I'm not doing that. I love football. I love baseball. I love wrestling. Like, I'm into sports.
I love it. That's why you're the greatest, man. You're a great sportsman. God bless you.
Love it.
Listen, continue, and thank you. Thank you for doing God's work, buddy. We appreciate it.
Yeah, thanks for being in that trauma room at 1:30 in the morning when I came in. I appreciate it.
And hopefully we won't see you again in a trauma room.
That'll be
anymore.
good. Yes. Yes.
All right, guys. Have a nice day.
The great Dr. Vaccaro from Rothman joining us.